Hello, we'll look at how ChatGPT, an artificial intelligence language that until now used to be restricted to coders and developers, could potentially be used by doctors. And I'm recording this because I just have a lot of doctor friends, and this is kind of a fun experiment to see whether I can do a self-diagnosis here on video. Now, it is important to note that I am not a medical doctor. I don't have medical training. I don't claim that what I'm showing here is even close to the truth. Maybe this is way off. You are the experts, and I don't intend to replace your expertise. We always need you doctors. However, this tool might be of help to you. Who knows? I think it could help you with diagnosis, with treatment plan suggestions, and also answer difficult questions that your patients may have and you have no idea what the answer is. You just cannot know everything, right? All right, so what we're going to try is I have this, I don't know if you can see it here on camera, but about 2 years ago, I developed this skin coloration here around my eyes. I probably have to come close so you can see it. It's kind of a dark patch around my eyes, and it's also here on my nose. So it goes here, see, it goes there. So we're going to try, I'm going to attempt a self-diagnosis here with this tool, and we'll see what happens, right? Fun experiment. All right, let's get started. I'm going to include, by the way, in the description of this video, a link that takes you to where this tool lives. It's free to use and you can sign up yourself and play with it. But for now, I'm going to share my screen and go to the ChatGPT. All right, so the way this works is that here in the bottom, you have a field where you can enter any kind of information, really, any kind of questions you have. Think of this tool as a smart person who has read and seen almost everything that's conceivable. Okay, so I will put in here, I am a doctor and I am seeing a patient who is 40 years old and has Indian origins. He lives in Texas, enjoys a vegan diet, and has recently developed dark skin patches around his eyes and on his nose. What could this be? Question mark. I'm hitting enter and the response is, this description suggests the possible of onchronosis, a condition that can occur as a result of hydroquinone, a skin lightening agent, for a prolonged period of time. Onchronosis typically presents as blue, black, or gray-brown macules, mostly commonly on sun-exposed areas such as the face, neck, and dorsal hands. It can also occur with other conditions such as with alkatonuria, a metabolic disorder. So it looks like its suggestion that I use this hydroquinone. And I'm probably butchering all these names because I'm not a medical doctor. Okay. So I don't use any of that. So I'm going to say the patient does not use any skin medication. Okay, I'm going to say this patient. If the patient does not use any skin lightening medication and has recently developed dark patches around the eyes and on the nose, it could be a pigmentation disorder known as acanthosis nigricans. This condition is characterized by thick, velvety, and darkly pigmented skin, which typically affects the armpits, necks, and other body folds. All right, so this is also not what I'm looking for here, right? Because it's not thick and it's not velvety. So I'm gonna enter this. The skin, the dark skin patches. Whoops, the dark skin patches are not thick or velvety. They are just slightly darker than the rest of his face. Based on the new information, the dark patches on the patient's face that are described as slightly and not velvety could be a condition called melasma. Melasma is a common pigmentation disorder characterized by symmetrical brown or gray-brown patches on the face, with typically occurring on the cheeks, forehead, upper lip, and chin. Okay, so I don't know. I'm gonna Google melasma and see what that looks like. And if it doesn't feel okay, that's an option. I don't think so, because it's really not on my cheeks. It's really restricted to the area directly around my eyes and on my nose. So I'm gonna say the discoloration is limited to the patient's eyes and nose. If the discoloration is limited to the patient's eyes and nose, it could be a condition called periorbital and nasal hyperpigmentation. This condition is characterized by darkening of the skin around the eyes and on the nose. It can be caused by sun exposure, genetic predisposition, or other underlying medical conditions. Would be important to check the patient's medical history and past history of eczema, allergies, or use of topical oral steroids. Okay. Now I want to see what this is. Periorbital and nasal hyperpigmentation. Okay. Let's see images. All right. Okay. I think this gets closer. That looks a lot more like what I have. Okay. Like especially this image here, that is really, this is stronger, but it kind of reminds me of that. And one thing I see here, by the way, is that this is in the Indian Journal of Dermatology. So my father is from India, right? And this person here is also of Indian origin. So I would say I'm curious to know if that has anything to do with it. So, and also, let me see. Would the person's Indian origins impact the diagnosis? Question mark. So it says a person's ethnic background can be a useful piece of information when considering possible diagnosis. Pigmentation disorders such as melasma and periorbital and nasal hyperpigmentation can occur in people of all ethnic backgrounds, but they are more common in people with dark skin types, such as those of Indian, African, and Hispanic descent. Okay. Okay, with my layman knowledge here, I believe that this is pretty close to what I have here. So I will say it looks like this is a case of periorbital okay, hyperpigmentation. What can I suggest as a treatment plan? Question mark. Periorbital hyperpigmentation, also known as periorbital melanosis, is a common condition characterized by darkening of the skin around the eyes. There are several treatment options available for periorbital hyperpigmentation, the choice of which will depend on the underlying cause of the pigmentation and the severity of the discoloration. Some common treatment options include topical lightening agents, topical retinoids, chemical peels, sun protection, cryotherapy, or lasers. Okay. It is also important to address any underlying medical conditions that may be contributing to the hyperpigmentation, such as eczema or allergies. Okay. Let's see. Sun protection, okay, very important here in Texas. Cryotherapy. In severe and persistent cases, cryotherapy or laser therapy can be considered, but this approach should only be done under the supervision of a trained professional. Okay, so chemical peels, topical retinoids, and lightening agents. Well, so I am one of those stubborn people who don't want to use any topical medications. So I'm going to say the patient refuses the use of any topical medication. If the patient is unwilling to use topical medications, there are few other options that can be considered for the treatment of periorbital hyperpigmentation. Sun protection being number one, cosmetics, all right, concealers, colored makeup, cryotherapy or lasers. Yeah, that's interesting. Nutritional recommendations. A diet rich in vitamin C, E, which are antioxidants. All right, okay. So here are two things that I'm interested. I'm a vegan, so I want to know, does the patient's vegan diet cause the condition? Okay. There's no evidence to suggest that a vegan diet directly causes periorbital hyperpigmentation. However, some people on vegan diet tend to have low levels of certain nutrients, such as vitamin B12 and vitamin D, which have an important role in the skin health. Okay, so what that means for me, take my supplements, my vitamin B12 supplements. That seems to be very important. And also the D, of course. And then, of course, the tool gives me lots of disclaimers. Now I will say, okay, I'm interested in the cryotherapy. Okay, so I will ask, are there any risk factors to cryotherapy? Because I'm asking my doctor that, right? And then I'm getting a cryotherapy is a treatment method that uses extremely cold temperatures to destroy abnormal cells. Common side effects are pain or discomfort. Okay, I can live with that. Swelling and redness. Okay, but that subsides. Scarring. When the treatment, if the treatment is not performed correctly, okay, so I would go to a specialist. Hypopigmentation, so the treated area can become lighter than the surrounding skin, okay, so that makes sense. Hyperpigmentation. Cryotherapy can cause the treated area to become darker than the surrounding skin. Okay. And nerve damage. There's a small risk of nerve damage, especially if the procedure is not performed properly, but it is rare. Okay. So that gives me some good answers. Now, the last thing I want to know is cryotherapy expensive in Texas? Let me just, because I live in Texas. And then it gives me, okay, the cost of cryotherapy can vary depending on a number of factors, such as the location of the treatment center, the type of cryotherapy used, and the individual's insurance coverage. In general, cryotherapy is considered a relatively expensive procedure, but the cost may vary widely depending on the factors mentioned before. In Texas, the cost of cryotherapy can vary depending on the location of the treatment center. Some cryotherapy centers offer a single session for as low as $20, but it can go up to 60 or more for a single session. Okay, and then it talks about package deals. Keep in mind that the cost of the last paragraph is keep in mind that the cost of cryotherapy is not the only factor to consider when making a decision. Okay. I would say this is pretty awesome. Okay, I'm going to stop here. And I hope I have given you some inspiration as medical professionals and also professionals in the healthcare and wellness space to embrace this technology because it is clearly, undeniably very, very powerful. To be quite honest, I no longer feel the need to I feel like I self-diagnosed this situation here, okay? And I feel good about it. It's okay. I think I'm okay. I'm just gonna wear my sun protection, make sure I have my vitamin, my B12 supplements, and then that's it. You know, it's not life-threatening or anything. Maybe if I'm on camera, I'll consider cosmetics, but I'm not interested in those lightning topical agents. Okay, well, if this was valuable to you, if you thought that this presentation was impressive, let me know. Also, I'm interested to know, do you think this is good or bad? Do you think this is a positive development for humankind or not, right? And definitely follow me for more information around this. And the possibilities are limitless. This tool here can replace your second opinion, or can be an alternative to your second opinion. It can act as a specialist to whom you just ask a quick second opinion, or third opinion. And I would say that is very valuable, especially for some of you who may be in remote areas and who do not have access to people right away. All right, that's it for today. Thank you so much for your attention, and I'll see you again here on this platform.